Gina, give us the high sign for when we should start. I don't know if we want to wait another minute just in case.
We have the recording going. It's 2 o'clock. So
Well, I'll start with the introductions, and if somebody comes in late, they'll be able to catch up on that. So hi, everybody. Thanks for being here. I'm Marian Erickson. I'm a professor at Ithaca College and also the convener of the Program Resource Development Work Group for AGHE. And so I'm glad to have Tamar and Marilyn with us here today. They're the co-editors for the 7th edition of the Academy for Gerontology and Higher Education's Gerontology and Geriatrics Curricular Standards and Guidelines in Higher Education. Tamar is an associate professor in human development at Eckerd College in Florida, and Marilyn is a professor and director for geriatrics education and research at the University of New England College of Osteopathic Medicine in Maine. So I'm going to let Tamar and Marilyn get started. I'll monitor the chat if you have clarification questions, but we'll have time at the end for more robust discussion. So thanks, Tamar and Marilyn, for being here.
Thank you, Marianne. So let me get this started. Okay.
Great. Okay. Well, welcome to our webinar on the new standards and guidelines in higher education. I'm Tamar and Marilyn here. We don't have anything to disclose. I love this. We wish we did, but we don't. So we can move on. Our agenda, thank you, Marianne, for introducing us. Marilyn's going to do a check-in. I'll do a little introduction to the standards and guidelines and discuss some of the gerontology chapters. And Marilyn will discuss the health professions chapters and the POM program. And then please send your questions in the chat. And Marianne will be kind enough to be monitoring that for us, and we'll get those to us at the end.
Okay. So if some of you could just either yell out or put in the chat why it is that you wanted to attend this seminar. Tamar and I want to make sure that we address your burning desires regarding this document. So could somebody just take off your mute and just yell some things out? I see a chat, new program. Okay, new faculty. Nice. Okay. Anything else? Anybody? We had 25 of us. I'm eager to hear. Okay. Well, Joe, thank you for show up. Here we go. Now we're getting developing new certificate. Great. We'll definitely address, lead you in the right direction there, Jessica. Okay, well, as we mentioned, there's definitely opportunities for asking questions. And we'll move to our next slide. Okay, Tamar, take it over. Tamar, are you there?
I'm on mute. Okay, so I was speaking, but I see some more comments. Thanks for I see them rolling in. So briefly, the standards and guidelines, they were first published in 1989, and this is the document that sets the standards and guidelines for development of gerontology and geriatrics academic programs. As the field has evolved over the last 30 plus years, this publication has evolved as well, and it's meeting the increased demand for breadth and depth of these gerontology and geriatrics programs. So this edition provides the familiar resources for gerontology and health professions programs, offering a collection of expert recommendations for program development in the field of aging. The content, as you see here in the table of contents, spans the type of credential awarded and program focus, including healthcare, policy, education, and social services. Included are curriculum and policy recommendations for these programs. And also includes, there are also 7 appendices that I don't have listed here with curricular matrices and mapping tools for ease of application. Chapters 3 through 8 focus on the application of competencies for gerontology programs at the degree, minor, or certificate level, so associate, baccalaureate, and graduate level. And chapter 9 focuses on the doctoral level gerontology programs that have a lot of broad variability, so do not necessarily apply the AGHE competencies for undergraduate and graduate education, which I'll talk about a little bit later. Chapters 10 through 12 provide competencies for gerontology and geriatrics within health professions education. So really, you have everything that you need right here in this document. And as a whole, the standards and guidelines is intended to provide a model for institutions of higher ed to follow in the development of new programs that I see some of you are interested in, a basis for program assessment and evaluation, as well as a basis for existing programs, program guidance, and for academic or institutional reviews, including the AGHE POM designation, which we'll discuss later. And lastly, a platform for what constitutes a program of study in gerontology or health professions programs for potential students, the public, and employers. So we can go to our next slide. And new to the edition, this edition for gerontology programs, except at the doctoral level, is a focus on the integration of the extensively vetted AGHE gerontology competencies for undergraduate and graduate education. These competencies have been around since 2014 and recently updated in 2020 with no substantial changes at that time. 3 categories of competencies exist. There's a table in chapter 1 that outlines this, and each includes a domain, core competency statements, and recommended competency content categories. These are really designed to be very easily utilized to form learning objectives for courses and programs. Content in this edition are designed to aid in navigating through chapters and across disciplines. So each chapter includes the following, includes the description of the credential, gerontology or health professions competencies, practicum field placement, specializations or tracks, program assessments, administrative considerations, program advisory committee, career information, references, and ending on suggested readings. The one exception to this is chapter 12, which is the medical education, geriatrics, and gerontology competencies for osteopathic medical schools. There, they adhere to the structure when it's congruent with the medical education. So in chapter 2, you'll find that that's titled Chapter Anatomy for Gerontology and Health Professions. It defines each of those sections and what you can find in them within every chapter. With all of this in mind, I'm going to go on to review chapters 3 through 9, the gerontology programs. And we can, first I'll start with key points, and then I will go on to that. So to start, all chapters, with again the exception of chapter 9 on doctoral programs, include a new to this edition gerontology competency section, which refers the reader to the curricular matrix and mapping tool in the appendix. There are certain degrees traditionally require an accepted number of credit hours, ranging from 18 to 24 for undergraduate certificates and minors, to a range of 30 to 60 hours for master's programs and up to 69 hours for doctoral programs. In the past, these credits were derived from courses such as required gerontology core courses, gerontology electives, and oftentimes some kind of practical experience or internship or practicum. In chapter 3 through 8, the key idea is that competency-based education allows for more flexibility by emphasizing gerontology knowledge, attitudes, and skills development through competency attainment within courses, which can easily be identified using that curricular matrix and mapping tool that I'll speak about in a moment. Utilizing the competencies mapping tools provides an outline of the competencies and student learning outcomes included in each course and how these competencies and learning outcomes are assessed. So yes, we will go to our next, where I'll talk a little bit more about this matrix. So for example, in associate degree level learning objectives are to be created to ensure that all core competencies in categories 1 and 2 are taught, and at least 2 from category 3. For bachelor degree programs, competencies within courses need to include category 1 and 2 or more selective competencies from category 3 that best reflect the orientation of that program. The undergraduate certificate programs and minors should result in students with an understanding of the core competencies, which includes the foundational in category 1 and the interactional in category 2 competencies. Program learning objectives should be created to ensure that all core competencies are covered, including at least 2 of the contextual competencies in category 3, depending on the strengths, again, and orientation of the program or institution. So I'm just going to kind of, again, briefly go over these different degrees, just because I see that there's interest in lots of different areas. The continuing education certificate programs in gerontology should address categories 1 and 2. Graduate certificates focus on categories 1 and 2 and recognizes that in order to guarantee a minimum base, competencies that are associated with sociology, psychology, biology, or health aspects of aging are essential to program development. Additional competencies should then be selected from category 3 based on individual gerontology graduate certificate program goals. I mentioned earlier that competencies are outlined for all chapters except chapter 9 on the doctoral programs, because competencies do not apply to doctoral level gerontology programs. The doctoral curriculum remains focused on a range of credits rather than competencies. And so there's still information there that would be useful for doctoral programs. In Appendix B, you're going to find the mapping tool, where for each of these 3 categories, you can indicate the course number and department as applicable, the type of program. So you'll specify the degree, is it associate, baccalaureate, master's, or certificate, the year in program that the course is taught, is it first year, second year, when is it taught? And this tool also codes coverage of competency content from fully covered to not covered. So in your evaluation methods, you will go through, you'll check all that apply among your options. So it'll be, how is this content presented in test, paper, presentation, demonstration? So that mapping tool is there for these gerontology programs. And again, like I said, has been recently updated and is all here in this document for you. So I'm going to pass it to Marilyn, who's going to discuss the health professions programs that's been using these competencies for a long time. And I will pass it to you. Thank you.
Okay, thanks, Tamar. And at any point, once you have the standards and guidelines document, if you need any clarification or assistance as you go along, please reach out to Tamar or me, and we're happy to help you out with that. You can always reach us through Gina if that's a little bit easier for you. So to go into the health professions, as Tamar mentioned, chapters 10, 11, and 12 are dedicated to the health professions. We actually started off way back. This document actually gets renewed every 5 years. And we had this giant interdisciplinary work group to create chapter 10, which I'll get into a little bit more. And then we went into chapter 12, and that was 5 years ago. And then the newest chapter is the Doctor of Pharmacy program. Now, with this document being renewed every 5 years, we know that there are competencies for social work. There may be competencies for elder ministries. I mean, there may be competencies for anything that can be added to the gerontology standards and guidelines document. As long as there are competencies related to geriatrics gerontology, that academic program or professional program can definitely be added to this document. So we'd really like for this to be much broader than the 12 chapters that we currently have now. So just keep that in mind. So for the gerontology, the standards and guidelines document, let's just use short term here. This is an opportunity to really bring in gerontology and geriatrics competencies into the health professions. You need not create in any of your health professions programs a separate course. This is really designed. We know that you are under accreditation guidelines, but it's designed so that you can implement and make identifiable the competencies that are applying to gerontology/geriatrics. So one of the options that is really useful for all the chapters is that, and I'm going to raise a comment that Joanne put in the chat, and that was that some of the Gero programs are being threatened. And because of that, here's an opportunity to create or to connect any gerontology program or certificate program with any of your health professions programs. So we see that in the program of merit, where programs are showing those interconnections that they have between health professions and Gero. And that's really a nice way to keep your gerontology program really viable, is one way to put it, and really advance your health professions. What is really concerning to me with the health professions programs is that by and large, many of our graduates are going to be working with older adults, and that is not included in the curriculum, that kind of training. And in the world of social work, the latest data that I saw was about 3% of social work's graduates want to work with older adults. And the truth of the matter is that, 95% are going to be working with older adults in some capacity. When they're even focused on working with children, they're going to be dealing with the grandparents as the primary care providers of those children. So getting competencies in is very, very important. The geriatrics and gerontology within these health professions programs, we're really looking at the broad implications. So we're looking at the cultural, the psychosocial, as well as the health. So we're managing all those together. And all you really need is identifiable objectives, not a separate course. You don't need to really change the curriculum. You just need to integrate geriatrics, gerontology competencies based on the health professions program. So if it's any health professions program, except for the osteopathic medicine and except for pharmacy, then chapter 10 is the chapter that you want to pay attention to. It is based on the Partnership for Health and Aging Competencies. We have not found an updated edition. So we're still going with the 2010 edition, and it's the multidisciplinary competencies in the care of older adults. This is in the standards and guidelines document. It was endorsed by AGHE and over 50 other interdisciplinary health professions programs. And so we felt that this was a good foundation for any health profession program that wanted to be either recognized through the program of merit, and especially to prepare their students to work with older adults. Chapter 11, this is the new chapter, as I mentioned, and we were waiting to the very last minute for the American Society of Consultant Pharmacists to publish their competencies. So these are brand new. And I was working with Sydney Springer, who's certified geriatrics in pharmacy, and also Patty Slatum, PharmD, also certified in geriatrics. And the three of us put this chapter together and based it on these new guidelines. Now, Patty was connected with the society to keep us abreast of what was happening with these competencies. And when we knew we were going to make it for the AGHE Standards and Guidelines document. So this is the website for those if you want to see what those competencies are, or certainly they are in the AGHE Standards and Guidelines. Chapter 12, I'm at an osteopathic medical school. We really have some added tools that we use that is separate from an allopathic school, or what we call an MD, a medical doctor school. And the bottom line is that there is one set of guidelines for both osteopathic and allopathic medicine, DO and MD. And that's the American Geriatrics Society. They updated their competencies to include the 5 M's. And there is the age-friendly health systems that focuses on the 4 M's. And those 4 M's are, if you're not familiar with it, matters most, or what matters, mentation, so cognition, mobilization, physical function, and medication. So we're looking at the prescriptions and polypharmacy. The 5th M in the standards, in the competencies for AGS, is morbidity. And those are multiple conditions that older adults might have. So this chapter is focused on that. It would apply for allopathic schools, but the one piece that we added in is that there's a tool that doctors of osteopathic medicine may use if they so choose, or have a practice in it, and that's OMM, which is osteopathic manipulative medicine. And it's also referred to as neuromuscular medicine. And so there are competencies related to that and expectations that are in this chapter. So with that, I will move on to the program of merit, just a quick wrap up, and then we will open this for discussion so that we can really dive deep into any of your questions. The AGHE Program of Merit was started essentially in 1995 to be formulated. Large number of people really weighing in on this. And in 1998, it became an official program. It isn't a globally recognized evaluation of gerontology and also health professions programs. It was 2015 that we wrote this, the Program of Merit guidelines for health professions programs. So with that, if it's a volunteer evaluation process of your program, it is definitely at a low cost compared to accreditation, but it would verify the program's credibility and quality regarding either gerontology or gerontology geriatrics. It really lets your campus leadership know that you're following global guidelines and expectations regarding the practices in aging. It will add marketing leverage for you to recruit prospective students. Geriatrics here at our College of Osteopathic Medicine is one of our top 3 areas. We have over actually 50 hours of geriatrics in our medical school. By and large, medical schools, if they have 5 hours in the first 2 years, is remarkable. And here we have 50 hours. And that in and of itself, our students are coming to UNE because we have more and more medical students interested in working with geriatrics and or palliative medicine, which we focus on. So it would assure quality of your graduates that graduate from a program of merit designated school. And it would substantiate for employers that your student graduates from a program of merit have met the competencies in either gerontology or geriatrics. And for each of the students that graduate from a program of merit, we have a certificate, something like this. Bear with me, but this kind of information recognizing excellence in gerontology and geriatrics, be it known, and you have your student graduate name there, recognized as graduating from an AGHE Program of Merit, and it's the prescribed curriculum and requirements offered by the name of your institution and the name of your program. So if it's a certificate in gerontology, if it's a master's in gerontology, if it's a nursing program, that would be put there the year of their graduation and then signed by the AGHE chair and the GSA executive director. A list would need to be sent to, I believe it's Gina, but would be sent to GSA And these certificates will be made up for each of your graduates. Each year you are a recognized program of merit. Now, for a health professions student, this can easily be suitable for framing and put it in their office where they're practicing. And it just, I think, really conveys a message that our students that are coming from programs of merit are really skilled or trained in geriatrics or gerontology. So this was a flyby of the S&G document. And we have Tamar's email, my email. We have Gina's contact if you're interested in the program of merit. But now we have an opportunity to see each other, which is more important, and really have a discussion and address questions. And if you're okay with it, I want to mention just some of the things. Joe, you mentioned that you have new faculty. And for new faculty to really understand the specifics, either in gerontology or in any of the health professions programs, for them to be familiar with the AGHE standards and guidelines, for them to read through those chapters that apply to the programs that are at your institution, that would give them a leg up to really understand. And regardless of your program meeting those standards or guidelines or not, the more faculty that you have on board understanding what those standards and guidelines are, then you could create that team within your department and move forward as a collective unit to try to meet those standards and guidelines and make those adjustments. For Jessica, you mentioned that you're developing a new certificate program. You absolutely would benefit from looking at the standards and guidelines. The reason for doing that would be so many institutions have started up programs without referring to the standards and guidelines, have contacted me to talk about becoming a program of merit. And then the program doesn't meet the standards and guidelines. And so they have to, revamp if they're willing to go, if they're willing to do that to move forward with the program of merit application. It's just better knowing ahead of time what the standards are so that you can address those while you're developing that new program. Okay. Paul, you mentioned about mapping across programs, and if that's gerontology, I'm happy to turn that over to Tamar. Tamar, do you want to address that one about mapping across programs?
Understanding what others are doing and how it maps across other programs. Do you want to just clarify just to make sure I know what you're talking
That's
about?
Paul. So
Hello. Yeah, I'm the pain in everyone's side. I apologize. So yeah, I guess it was really interesting to see, because I use it as bedside reading to go through the standards and guidelines document. It's really interesting to see how it's very specific in terms of, okay, if you've got a program that is this, or for example, with the farm, it was great to see how you've mapped it onto those competencies. And I thought that was, I'll be honest with you, it was really impressive. And the fact that you've actually managed to do it is, I mean, kudos to you. But in terms of specific, I know that many programs aren't specific gerontology programs. They just include some form of gerontological education in them. But I don't know. I know I'm banging on the same drum, but I'm not. I don't have any disclosures. I don't have any investments in it in any way, shape, or form. But in terms of, you've obviously mapped to other sets of competencies, but there wasn't a mention in there to any accreditation, gerontology accreditation competencies.
Oh, well, gerontology accreditation, Paul, does use the AGHE competencies. Is that?
Yeah, obviously, without wanting to name drop on it, the AGHE ones, for example.
Yeah. Well, many of us in AGHE and GSA worked with AGHE.
Oh, completely. Yeah, I think when I was speaking to them, they mentioned, they name dropped you many times, Marilyn.
Oops, that's because I was in trouble with them. But, well, I mean, we're all one, right? We're all trying to move gerontology forward.
Absolutely.
So,
Yeah, and I think, yeah.
Oh, sorry, Karen.
Go ahead.
you're on, Paul.
You're on.
Oh, no. I was handing over to Tamar. I was only going to comment on what you just said, Marilyn.
Tamar, what's your thought?
I was just gonna, yeah, I mean, I was just gonna agree with Mary on that. We're all one, and there are many members from AGHE in our lots of the different iterations of this, and writing, some of the chapters as well. Am I correct on that, Marilyn? And
Mhm.
yeah, a collaborative effort, and so it seems like we're very aligned.
Yeah, I know, because we're looking to develop a lot more professional programs now outside of our traditional programs, and these competencies are more specific than the AGHE, and I think it would work really nicely. So, I mean, you might get some more badgering emails from me saying, "Oh, how do I apply this?" But yeah, I think it's really good. Thank you very much for today.
I think
Paul, if you don't mind just defining, only because I'm in health professions, traditional versus professional programs. Are you?
Yes, so we have
applied?
obviously we have a whole raft of master's programs which are specifically in gerontology. But for example, what we're doing is we're developing caregivers courses with caregiving institutions. So they're going to be very, very much applied, very much smaller, and they're not going to be master's level.
Okay, that helped, because I would be using professional programs in the same way.
That's good to know.
Around health professions, yeah.
Yeah.
Okay.
I think a lesson that I learned in helping edit this is, you just focus on those learning goals and those learning outcomes for those programs, and go from there, rather than thinking, okay, they need to know, they need to have this course and this course and this course. What do you want them to take from it? Because that's such a practical type of skills that they're going to need. So I think that's something to take from.
Absolutely. Those learning objectives are critical, right? And then you can figure out which kind of courses you want to get those learning objectives into, to really focus on what it is you want to accomplish. So thanks, Paul. Always love your enthusiasm. You've been to some of the POM sessions, so thanks. I'm going to address Susan. Susan said that she wanted some new ideas. Susan, we really just went over the document. Is there any way we can help you with new ideas? And we have a wealth of information on this webinar today.
Thank you so much. I got what I wanted, and you explained it really well. I really appreciate it.
Well, just give a holler if we can be helpful at all. And then Joanne, I had mentioned you already because you had put in the chat that gerontology programs are threatened right now. You want to add to that and let us know how you feel this standards and guidelines document could be helpful.
Well, and it also in a way connects to the other comment that I had in there about, how do you deal with pushback in other programs where they say, oh, we already have a lot of content. But I think what I was thinking about mainly when I was recognizing that, some gerontology programs have been dissolved. And so one strategy that my colleagues in those areas have been doing is saying, well, we don't want to lose things. So how do we kind of move over and integrate it in other areas of the curriculum? So it's there. And as you said, Marilyn, it's not just about adding a new course, but being able to integrate the content into other classes. And that's where the competency approach, I think, is exceptionally valuable, because that's a real tool that folks could use and draw on. But even in doing that, I run into it. We have a big health science, exercise science program, but I still run into, we already have so much in our courses. You hate making the demographic argument. So,
Yeah.
I'm just wondering what other ways, is it working with administration? Is it working with individual faculty? I mean, what are the carrots that you can use? Or the sledgehammers that you can use to do it. So there's a lot in that comment, but you can pick whatever you'd like to respond back to.
Is there anybody on the webinar that has a response for Joanne or some thoughts about what Joanne just said? Just take yourself off mute. We're eager to hear from you.
Okay. Hi, Joanne. My name is Marcy Myers. I'm at St. Catherine University in St. Paul, Minnesota. And so I'm a biology professor, but I'm a co-PI on a ADAR grant for trying to train a diverse set of students to be longevity and aging researchers. And one of the things that we've used to scaffold their learning is a minor in longevity and aging, and we only have one new course. What we did was we had some grant money that we could salt around to help identify faculty who already had some content maybe, or who would seem to, their course would naturally intersect with these issues of longevity and aging, and they would enhance that in their course, or grid. We would use the AGHE grid and they would show us where they thought they intersected. Then we would include them in the minor, and in this kind of enrollment strap time, that helps attract students to that class. We have them across the 3 layers, the biology, psychology, and sociology foundation, but we also have, people who are doing humanities kind of related things. So we have both our sort of biomedical care scholars, and then we have a wider minor that's been attracting a lot of students because it's using so many existing courses and enhancing, just having the intentionality of the professor to think about this as being longevity and aging related. And we just keep reminding everybody that as an embryo, you start aging. You do. I mean, what we do is pile up health inequities because of our society. So it's all kind of one thing. Okay, that's my
Marcy,
comment.
I'm curious, is the, I don't know if you want to call it a field placement, an internship, a practicum, is that aging focused?
Since this is a minor, we have students from a number of different majors who are in our Care Scholars Grant. So we have biology students, public health, exercise science, and psychology kind of have been our main areas. And some of them have major practical. So we work with their major. Oh, I did leave out one important point. Because this is multidisciplinary, we have them grid the classes that are part of the major and, say what competencies they have. And then they reflect on those and they build a portfolio that at the end, we do kind of a capstone where they pull these pieces together and reflect on the metacognitive learning that they've done across these domains. And if their major had a practicum, we have them include their kind of majors capstone experience or their field practicum or whatever it is, and relate it in that context. So we're trying to, as much as possible, use what already exists there, which seems a little bit better sell. And sometimes just having a little money for a faculty member in the summer will help them look at their syllabus and try to engage with you. So in terms of carrot, that's what I would say.
Yeah, good. Thank you. Anybody else? Carrots or pearls of wisdom to share?
There's a question in the chat, Marilyn, from Brittany Howell. Hi, Brittany. Chapter 10 outlines about 40 learning objectives. Does that disqualify a program that doesn't quite address them all? Say 36.
Oh, that's an excellent question. So no, you do not need to address them all. And actually, in the program of merit, we talk about meeting the spirit of the guidelines. And I think what I would prefer, Brittany, is for us to plan a phone conversation. You can either reach me through Gina or you can email me directly, and we can talk about it so I can get a better sense, so we can dive deep into what's happening in your program. And Brittany, which program are you talking about? Or Marianne, did she say?
Brittany, do you want to unmute?
Sure. I was actually just thinking of 2 different programs, but one is a health sciences baccalaureate degree.
Oh, okay. Yeah. So I definitely let's talk, because you can give me a sense of the competence. If you can go through chapter 10, look at the competencies and let me know what you feel you're really addressing well. And it sounds like it's a baccalaureate program, so that will give you some latitude as well.
Thank you.
There's another interesting question, and not directly about the competencies. Sorry, it says meeting participants, so I'm not sure who this is, but do you have a recommendation regarding a gerontological certificate that has a focus on Alzheimer's disease for nursing faculty who are teaching gerontology? So more of a professional development tack. Any ideas from Marilyn Tamar or anybody else?
So I'm curious, is this a certificate that you would like to start, or is a certificate that you're hoping is in place already to bring into your program? Whoever meeting participant is.
to participate. It says to participate.
Yeah, it's, I'm wondering if it's a
Yeah.
program that you want to bring in, or it's a program that you.
I
wanna
think it's
develop.
training that they want for their faculty.
Training for your faculty. Okay, I'm sorry, I misunderstood that. Actually, I think the best, I'm gonna say best for right now, so bear with me. There used to be a Gerontological Nurses Association, and that actually went by the wayside, which was really kind of sad because they were a great bunch of folks. There are leaders from the former Hartford Foundation Geriatric Nursing Leadership Academy. I'm not a nurse, but I was a mentor for that program for advanced practice nurses and BSN nurses. And so if you want to reach out to me, I'm happy to make those connections. But I'm not sure if you checked into the Alzheimer's Association, that there are programs that they have, and maybe in your state chapter, programs about how to communicate with people with dementia, which is designed a formal program of how to do that. And I'm sure that the Alzheimer's Association or your state chapter or your state chapter could help you with faculty development and how to move forward. Does that help?
She just put in the chat or that there's a
Advanced practice nursing.
specialist
So-
certification.
So yes, yeah. So then they must have some competencies, right, for that association?
Hey, this is Christy Wick. I'm a nurse practitioner in DNP. That's strictly through GAPNA, and it's an extra certification for geriatric nurse practitioners. When I went through school, there weren't or at least our program didn't have like an acute gerontology nurse practitioner program. So I have a family nurse practitioner, but then there are criteria just like for licensing, certain amount of credit hours, clinical practice hours, and then a certification exam. So it's just in addition to your licensure. So they do hold that. Now, some of the dementia pieces are covered in that, of course, because it's a geriatric certification. So whoever this is welcome to reach out to me. I have a couple other ideas, but that is an actual certification that can be added on.
Thank you. That's very helpful. And also it's the nurses that really moved away from the word geriatrics and really were purposeful about using the word gerontological. So it's nice to see that that carried through here. And just by way of a side note, that if you know of any nurse practitioners that refer to themselves as a geriatric nurse practitioner, geriatric is an adjective and it's a person or thing with significant disorders. And so tell them to please put the S on that to make it a noun, and that they're a geriatrics nurse practitioner rather than a nurse practitioner with significant disorders. A little nuanced, but important all the same. Joanne, thank you for putting up the ageism first aid, GSA AGHE ageism first aid link. There's a lot of modules in that. That was worked on by Lorinda in California, and just really did a great job with that. So, and again, she used a team effort to make that happen. Other questions, comments?
So yeah, and also, thanks Marcy for sharing how you use the standards and the competencies. If anyone would like to share how they've used it, if they have, how they're thinking of using it, or other general questions, we would love to hear.
We're really eager to help. Let me say for nursing, we have no programs of merit in nursing right now. We have 3 programs that are signed up to do an application for it. Pharmacy, I know Patty Slatum, who wrote the chapter, is is working on an application right now to be the first pharmacy school. Ironically, for College of Osteopathic Medicine, we paid our fee, and I haven't had a chance to do the application, which is kind of embarrassing, but that's true. So you could be leading in terms of programs in the program of merit in health professions. In gerontology, all the programs, even the doctoral program, we have those that have submitted and been accepted. We will ensure, and we meaning Donna Weinrich out of Michigan State University and me, we are the co-chairs. We will ensure that a conversation with you will guide you enough to be supportive and to keep in mind about your administration and how you complete your application. We know the hot spots, we know assessment, make sure you have assessment in place in all your programs, health professions or otherwise, you know, gerontology. That's a weak spot in many of the programs is inadequate assessment. So we would work with you to say, absolutely, yes, pay your fee, put in your application, and we will work with you through that program. If there's holes anywhere, we'll let you know ahead of time and provide suggestions for how to fill those holes. Have the conversation with you to see where your administration is. We have had a few programs contact us and say, we need to raise the bar and let our administrators know that we are not meeting standards. And so we are purposely putting this in to get feedback from, and really GSA, AGHE, or international organizations, so that our administrators will see where we're missing information, where we need support, where we maybe need more staff, and to try to get the weight of AGHE GSA behind us to try to get those things implemented. So there's different ways to go about the program of merit. I see Gina put the website, and we just updated each of the applications and so that they meet the new standards and guidelines, so they relate.
Yeah, and I will
Other
say,
questions?
yeah,
Sorry.
Marilyn, it's a well-oiled machine, the POM program. So if, you know, if you're thinking of that, to speak to Marilyn, and I believe you are also were a big proponent of putting the assessment in every single chapter here in this document. So because you realize that was a whole, so in every single chapter, there's a section on assessment to help programs think about this prior to applying for POM.
Yeah, get those in place. Thanks, Tamar. Other questions, comments? We're happy to give you back time, but we just want to make sure that we're really addressing your questions.
I have just one quick comment. I want to get back to, I commented on how, gerontology programs in some places are being, disbanded. And I don't want that to seem, like I'm saying, oh, we're dying away. That's not it. Because another way to look at it is this is an important juncture where people are recognizing that aging studies and gerontology are not siloed programs, but they really need to be integrated throughout our other areas. And so to me, that makes this competency approach and the way that you've integrated into your, thinking about individual kinds of programs really important. So, I think there's always a silver lining and a downside of something, but I think we're at an important juncture to make use of those competencies in very intentional, strategic, and valuable ways.
And Joanne, now is, as you mentioned, we're interdisciplinary, but now is really the time to ensure that our health professions programs are partnering with their gerontology faculty to really raise the bar in health professions education. And as I mentioned earlier, any of the health professions, when I have, I'm teaching in most all of them, we have 15 health professions programs here. But even in our College of Osteopathic Medicine, the students will say, well, Dr. G, I'm not going into working with older adults. I'm really focusing on kids. And then you just give the Pew report and how many grandparents are the primary care providers for their grandchildren. And if anything should happen to the grandparent, that child is at risk, for foster care and just a terrible path. And so having all our health profession students be very aware of the healthcare and support of older adults is so, so critical.
Yeah, I think the competencies do that really well, and address that very issue that you're talking about, Joanne.
And I touched on cultural. Cultural is huge right now. And that's not only in the, across the world globally, but also in terms of gender fluidity, right? There's so many different cultures out there, and to ensure that all our students are prepared to work across various cultures is just so, so important. Anything else we can help you with? Oh, I like to be challenged. I'm just so bummed that nobody's like challenging us.
Well, I think Gina's going to make the recording available, so you'll have access to the slides and Marilyn and Tamar's contact information. So if, as usually happens, you're walking to your car tonight and you're like, oh, I meant to ask this. It's not too late.
And I want to mention, since Joanne's on screen here with us, that she is the chair for AGHE. And so everybody should know who Joanne is. So Joanne, we're here to support you through your chairship.
Thank you. And I really want to tell you how much we all appreciate the tremendous work that you did on pulling together the new update for the standards and guidelines. And like you said, it takes a village for sure. And you just did terrific work, and it's really important work that's going to really move us all forward in important ways. So thank you. And thanks for today.
You're welcome. And Tamar and I had way too much fun, didn't we, Tamar?
Yes. All through the pandemic, we had so much fun with this. Yes. Started around 2019 and here we are. So
Okay.
very thankful to everybody who contributed and participated. I mean, really couldn't have done it without our authors, our reviewers, Joanne, you as well, and helping get this off the ground. So thank you.
Everybody's listed in the standards and guidelines document. So they're also resources for you, as well as the authors of each chapter.
Great.
Marianne, thank you for moderating.
Yep.
Marianne.
And thanks, Gina, for setting it up.
Thank you, Gina.
Have a good afternoon, everybody.
Thanks, everybody.